Hi, my name is Eunice. I'm giving my presentation on cognitive therapy, behavioral therapy. Cognitive behavioral therapy can be used individually or in combination of a program of interventions known as cognitive behavioral therapy. In, in cognitive therapy, the therapist helps the patient identify and correct distorted maladaptive beliefs, while behavioral therapy uses thought exercises or real experiences to facilitate reduction and improve functioning. Introduction. Cognitive behavioral therapy is a form of psychotherapy that focuses on teaching or coaching to help modify dysfunctional emotions, behaviors, and thoughts by examining and extracting negative or irrational beliefs. This therapy was designed to be a preventative relapse method that helps individuals, patients understand and better manage their thoughts and emotions to achieve relief from distress. The therapy focuses on improving mental health. The purpose of cognitive behavioral therapy aims to empower people with the tools to change one maladaptive cognitive and behavioral patterns. The key aspect is to develop alternative ways of thinking and behaving to reduce psychological distress. Using cognitive behavioral therapy strategies to help individuals or patients learn how to cope with problems. For example, depression is a multidimensional disorder that comes with biological, psychological, social, and spiritual components. Using only antidepressants alone will not have a sufficient effect on depression treatment because there is a high relapse rate after the patient stops taking the medication. The therapy helps to improve the symptoms. Key terms. Cognitive behavioral therapy is based on the idea that we think, cognition, how we feel, how we act or behave at all together. Precisely our thoughts process determines our feeling and our behavior. Cognitive behavioral therapy, which is CBT, helps people develop alternative ways of thinking and behavior to reduce the psychological distress. Cognitive flexibility and control is the ability to change what you're thinking about. In other words, change your mind. Cognitive flexibility requires in multiple ways throughout the day. CBT is a form of psychotherapy generally developed to treat depression and anxiety, but is now used for several mental illnesses. It works towards changing helpful thinking and behavior to solve current problems. Types of behavioral therapy: we have computer based, we have telephone delivered, we have symptom assessment, and we have homework. All these are narrated. Cognitive behavioral therapy uses several techniques or components that address aspects of anxiety and the individual response to it. Those techniques include education, self monitoring, relaxation training, cognitive restructuring, exposure, and imagery exposure. The patient active elements of treatment active. The patient must physically actively involved, not listening, not sitting around observing. Motivation: the therapist create treatment plan and they provide the individual and the therapist with a way of measuring whether therapy is working. So the individual must get involved in the creation of the treatment plan. We also have directives as part of the elements of treatment, where the therapist's role should be to teach, listen, and encourage or help the individual achieve their goals. Assessment, signs, and symptoms using by DSM-5 diagnosis that commonly benefit from CBT is the evidence-based treatment for psychiatric disorders, including depression, generalized anxiety disorder, post-traumatic stress disorder, panic disorder, eating disorder, obsessive compulsive disorder, as well as several medical conditions, insomnia, smoking, lower back pain. The assessment continues. It has three phases of assessment. Um, the basis of assessment: The basis of assessing the patient in CBT are to understand the client's current life difficulties and the problems using a planned, structured, and systematic approach, which is essential for the formulation of patient's problem. Initial phase, assessing the patient motivation to change and treatment expectations. Middle phase, cognitive and behavioral strategies are implemented to address patients' unhelpful thoughts and behaviors better. Ending phase, this phase includes the importance of relapse prevention and a plan for discharge or termination. There's also components of CBT, which includes a brief mood checks, a bridge from the previous session, setting an agenda, a review of the earlier seasons of homework assignments, a review discussion of plan items, a homework assessment, and final summary. There's also Socratic dialogue. This is a mutual technique in which the therapist guide the patient through a series of questions and answers to assist patients to determine how accurate and helpful of specific thoughts may be. We also have downward arrow, leveling of distortions, and questioning, explaining, examining options and alternatives, attribution, decatastrophizing, turning adversities to advantage, cognitive rehearsal, evidence based. Evidence based on the study shows 156 patients received CBT and pharmacotherapy for treatment resistant depression in a primary care setting. Participants were randomized who received CBT at a minimum of 9 sessions. Individuals included all received diagnosis using the SM5 and they were on the adequate dose of antidepressant medication for at least 6 weeks. Data collected. Depression symptoms were analyzed using the Beck Depression Inventory. The outcome data for the full sample reported show a significant change in depression symptoms throughout CBT with pharmacotherapy. Another study using systematic review literature is analyzed on two current treatment modalities for depression: cognitive behavioral therapy and anti-depressive medication. The objective of the study is to lower the symptoms and to provide relief for depression. Antidepressant medication was used continuously for 6 months in patients with remission to avoid the risk of relapse. Depression was analysis using the Beck Depression Inventory. The conclusion proves CBT is as effective as ADM, which is antidepressive medication, but the effects of CBT are more lasting. In conclusion, CBT is the most widely researched psychotherapeutic model that has demonstrated effectiveness in treating a wide range of emotional, behavioral problems in mental health. CBT uses reasoning exercises or real experiences to facilitate symptom reduction and improve functioning. This is the end of my presentation. Thank you.